My name is Jonathan Bowman. I'm a vascular surgeon in private practice. I work with an organization called the Vascular Experts. I typically see anywhere from 20 to 30 patients a year with acute limb ischemia. The number one concern and consideration is to try to restore blood flow safely and effectively. And also you want to restore it such that the risk of reocclusion is not high. Typically we use a combination of open and endovascular treatments to deal with acute limb ischemia. We also use lytics, or we use TPA to try to help us overcome this acute occlusion. And all of them have certain pitfalls.
And that's where the Inari Artix device comes in.
The Artix device doesn't use any lytics. It's completely endovascular. In most cases, you won't require any incisions or anything like that. So being able to complete a revascularization with a total endovascular approach is very attractive. The support from Inari is very strong. The representatives that I work with are not just interested in the product, but I would say interested in the disease process itself that they treat. There's a lot of investment in the patient and the product. There's a lot of involvement with the company and the physicians as far as making sure the product works, making, if there's anything that needs to be changed or recommended that would be changed, that, it gets addressed somehow. In my prior experience, with the devices has been very positive. I know that as far as clot clearance goes, I think the company is definitely one of the thought leaders. And so it definitely made me more likely and ready to use a new product that they have, just because I know that the products that I have used are quality and they work very well. So the Artix basically comes with essentially a pretty complete toolkit to solve a lot of problems. They have a large bore sheath, smaller bore sheaths, long aspiration catheters, short aspiration catheters. The Artix device itself has two different sizes to allow you to go to smaller vessels, larger vessels. You can pretty much complete your goals with a totally percutaneous approach. So it really does offer, a bit of a complete package. I was actually lucky enough to be the first person to use it in a human. That patient, he had multi-level occlusions. He had both large vessels and small vessels. I was actually able to use the whole toolkit with regard to the Artix device. He had a very satisfactory result. We did the procedure in one stage. There was no incision required, no lytics required. He was able to go home the next day. So it really does give you the tools to I think give you a safer, more complete treatment. We did intravascular ultrasound exam prior to and after. There was no vessel damage. So what Artix does is it allows you to use a smaller access point up to an 8 French, but deliver essentially an 8 millimeter thrombectomy element to pull the clot out. Whereas aspiration catheters, at best they can really only offer you that 8 French size in which to remove the thrombus. And it is truly a more minimally invasive device. It has a relatively low access profile for the type of thrombectomy that it delivers, just because the mechanical thrombectomy elements, as I mentioned, they go from 6 to 8. They can treat from the tibials all the way up to the iliacs, and you're doing that essentially with a 7 French access. One of the other advantages of the device is the funnel catheter that is placed at the end of the access sheath in order to have kind of a flow arrest, so you're not having antegrade blood flow while you're completing your thrombectomy. And I believe that funnel goes up to about 8 millimeters, so comfortably fits into an external iliac artery, potentially even a common, without having a lot of worry that every time you do a pull, you're sending new clot down into the tibials. I don't think there's anything really on the market quite like Artix that could say that they could clear pretty much all of the acute clot out of the lumen. So I am holding the Artix system. As you can see here, it goes into the body constrained. There's a very little transition point here. It goes over an 0.14-inch wire. So I think Artix would be very easy to adopt. Most of the skills that are required to complete a case with Artix are the same skills that most interventionalists use on a daily basis. To deploy the MT device is a simple pin and pull method that we use on a variety of products. It is entirely over the wire, so you're always, in theory, or hopefully, will have your wire distal to the thrombosis so that you'll be able to control it better. And your options to restore blood flow will definitely be enhanced. So basically, when you're ready to deploy the element, it's kind of what we call a pin and pull method, which is a very common method to deploy stents and other endovascular devices. But you can deploy the element, usually distal to your clot, and you can kind of see the element here. It's just kind of very well engineered. It's very soft to the touch. As you kind of bring your fingers back this way, you can see where it probably has just enough force to remove the clot, but not enough force to really do much damage to an arterial wall. You can see here that the empty element itself, probably about 4 to 6 centimeters in length, just enough to probably remove most of the clot you're going to be dealing with. I think with the mechanical, you can definitely get a more chronic type of thrombus. Plus, you can also more precisely remove a clot, I think, with a little more confidence, as opposed to aspiration, where you're just kind of putting the catheter there, hoping that you get it. The Artix does allow precise planning and placement and removal of the clot. Artix definitely gives you kind of the best of both worlds. Inari raises the bar for arterial thrombectomy because it does give you the tools to complete the thrombectomy from start to finish with full clot removal, no lytics, no open surgery, ability to accommodate multiple different vessel sizes, multiple different lengths, multiple different access points to treat tibial vessels, popliteal vessels, SFA, iliacs, kind of all in one through one percutaneous access is a game changer.